Bismillahirrahmanirrahim. Welcome back. This is Presbycusis Part 2. The link for the Part 1 is there in the description. So let's start today's session. We have discussed the pathophysiology, etiological factors, and types of presbycusis. So today we will talk about its clinical presentation, investigations, and treatment. From the pathophysiology, now we have an idea that this is very slowly progressive disease with bilateral involvement, that both ears are involvement, and said this is sensory neural hearing loss and it is bilaterally symmetrical. This is an aging process. Sometimes it is associated with tinnitus, and even the term presbytinnitus has been coined for the tinnitus which is associated with presbycusis. There will be no other pathological cause for this hearing loss and tinnitus. And on examination, the normal ear examination is expected. Presentation of the patient varies as from pathophysiology and subtypes of presbycusis. We came to know that different parts of the cochlea are at the same time involved, and accordingly will be the presentation. But usually what will happen is that the patient will be having sensory neural hearing loss, so it will be high frequencies involvement. Patient will be having a problem with speech discrimination, that he knew that someone is talking, but what is being talked he would not be able to understand, especially when there is noisy, distracting environment. Then it becomes more difficult for him to understand the speech. Localizing the sound is also difficult for such patients, that from where the sound is coming actually. So there will be certain impacts with presbycusis, that those people who are around these old patients, they will not be taking care of them properly. They may be considering them disabled or handicapped, and may be asking them to seek for the help. They foster a sense of disability in them. So these people, because they could not understand what is being discussed, so the people avoid them during get-togethers, during parties, and ultimately they are being isolated and they refrain themselves from social gatherings. So they may restrict their usage of phones also, because on telephone also they would not be able to understand. So they forfeit their social events like marriages, like concerts, any social gatherings, because they are being realized of their hearing loss. So ultimately, social impact of this hearing loss is on the lives of these old people, like depression, withdrawal from social life, loneliness. It may trigger anger in these people. They feel themselves unsafe, cognitive decline, and ultimately there will be a poor mental and physical health. Blood tests for autoimmune, if history is suggestive of, we should go for that. Pure tone audiometry and speech discrimination. These are the two fundamental audiological tests, and any additional testing will depend upon history and clinical examination of such patients to rule out other possibility of any other symptoms in these patients. Prevention in the sense, because presbycusis itself is an aging process, so it cannot be prevented, but it can be delayed with good lifestyle or lifestyle changes, and preparing the old people to face all this mentally, so that they should not be left alone, or they should not be going into depression. So counseling is very important. Periodic pathological examination is necessary to rule out other debilitating or dangerous diseases of the ear or any other ailment in the body. Annual audiograms to see the progression of the disease, and career or lifestyle change, as I just mentioned. There is no effective surgical or medical treatment, but still we can help, though it is not curable, but its effects on the patient's lives can be changed. So we can use amplification devices like well-fitted hearing aids, but the patients who are having arthritis or who are having presbyopia or other visual problems at the same time in this particular age group, they need extra help to learn how to use these hearing aids, because these hearing aids, they have got small buttons to put it on and off, to our volume control, replacement of the batteries, etc. So the patient has to patients using hearing aids may still experience difficulties with speech discrimination, especially in noisy situations. Then 30% dietary caloric restriction can be helpful. Antioxidant therapy like vitamin A supplements, they say that it delays the aging as a whole. Then if diabetes or hyperlipidemia is there, that should be under control. Patient must be trained for lip reading. Then assisted listening devices like amplification of telephone signals. And if hearing aid is not helpful, even cochlear implant can be considered for such patients. So, precise hearing aid fitting. This is just sum up of what is the options available. Hearing assisted devices, lip reading classes, and then possible cochlear implant if hearing aid is not of much help. It is a slow deterioration, but neural presbycusis, it worsens more rapidly as compared to other types of presbycusis. Research is going on to look for underlying genetic cause. Then they say certain medications which can block production of reactive oxygen metabolites, they may treat presbycusis at molecular level. And then stem cell transplant into the cochlea in an attempt to regenerate the sensory cells may be an effective treatment in near future. So with that, we come to end of this topic, that is presbycusis. Any suggestions or queries are more than welcome. You can mention it in comment section. Thank you very much.